And it's not just women going under the knife. The new trend in male cosmetic surgery and what you need to know.
This is Chicago's very own WGN Midday News.
And next, plastic surgery is not just for women. Find out why more men are going under the knife to alter their physical appearance.
Welcome back to today's Style Files. You know, more men are going under the knife. The number of men looking to surgically enhance their physical appearance is growing, and we're joined now by Dr. Urban Wiseman from, what hospital are you with?
I'm at St. Joe's and Lake Forest and Highland Park.
Yeah, let's talk about this. Are we seeing more men getting cosmetic surgery even in this down economy?
We are. Actually, we are. You know, it's a misperception that cosmetic surgery and aesthetic treatments are only for women. It's really overall about 10% of all procedures are done on men.
Is that ratio changing any?
You know, it's slowly increasing. I'm noticing that in my practice also, that I'm seeing more men come in for rejuvenation procedures, whether it's non-surgical or surgical.
Are they a little nervous about it, though? Do they tell you they maybe feel like it makes them less manly or anything like that?
They do. They're a little self-conscious when they first walk in, but then, you know, we usually put them at ease. They usually see other men in the waiting room, and they tend to feel pretty comfortable after the consultation.
Yeah, and they're pretty open about it?
Yeah.
Yeah. What are some of the more popular procedures that men get?
Well, surgically for men, liposuction is the most popular procedure. Then eyelid surgery, nose jobs, male breast reduction is not an uncommon procedure for men to have.
Yeah.
Non-surgically.
Male breast reduction, really?
Yeah. It's called gynecomastia, where it's breast tissue in men, and most men actually do have some form of this, but it can become quite large, and it can almost look like a feminine breast, and it's very, you know, makes most men very self-conscious. Yeah.
Well, let's face it, the first wave of baby boomers are now almost becoming senior citizens. Is that one of the reasons we're seeing more men getting this?
You know, I think so. And some other reasons, especially with the changes in today's economy, people are working a lot longer, and you know, men that are working in their 50s, 60s, you know, they want to look, you know, longer like their younger counterparts.
Well, they're staying in the workplace longer too, and I have an idea that for a lot of men, it's business.
Absolutely, absolutely. They want to look fresh. They don't want to look, you know, when you're working, you don't want to look old. You don't want to look tired. You want to look fresh and energetic. You mentioned some of the surgical procedures, but what about some of the non-invasive procedures? Most of the cosmetic procedures being performed are non-invasive. 80% of all procedures are non-invasive, and the most common ones for men and women right now is Botox, laser hair removal, and skin resurfacing. Do you have any advice for men who are thinking about having this done? Any tips? Yeah, I mean, I think, you know, don't be too self-conscious about it. I think it is socially acceptable now to undergo aesthetic procedures to make yourself look better and feel better. And just always go in and get a consultation. You know, and if you think about it, you know, from early on, kids get braces on their teeth. I mean, that's a cosmetic procedure. Yeah, right. And you think it's almost like a natural extension of that. I think so. Yeah. I do. Yeah. What about money involved? Obviously, the surgical procedures cost quite a bit more. Right. Well, you know, surgery can be quite expensive. You know, there's another misperception, though, with aesthetic surgery and procedures is that it's only the rich that are doing it. You know, if you look at the statistics, about 85% of patients that are undergoing cosmetic surgery are working class. So I did not know that. Yeah, so it's not only for the rich and famous and the movie stars in Hollywood. Right. Dr. Wiseman, thanks so much. You're going to stick around and answer some of our viewer questions. If you'd like to talk to Dr. Wiseman or get a question answered, send him your questions, send them in, emails to WGNTV.com/midday. You can find the web chat portion on the top of the first page. So Dr. Wiseman can probably answer whatever question you have. Thanks for being with us, Doctor. Thanks a lot.